Good afternoon. My name is Linda Sousse, and I am an associate professor at the University of North Carolina in Chapel Hill, as well as the director for surgical critical care and trauma research here in the Department of Surgery. On behalf of my co-authors, who include Junya Hagiwara, Jeffrey Hunt, Jennifer Hunt, Oscar Suman, and Jeffrey DellaVolpe, I'd like to present a recent publication to CPTJ titled Use of Structured Exercise Program with Resistance Training for Veno-Venous Extracorporeal Membrane Oxygenation After Lung Transplantation. And this is a case report. So the case report really outlines one of our rehabilitation protocols. Now, the background for this rehabilitation protocol in a structured manner really is the severe cardiopulmonary dysfunction that ECMO patients experience. This tends to also be followed by an increase in cytokine storm, the increased use of sedation and the ventilator with potential delirium, prolonged bed rest and immobility, which leads to an increase in muscle wasting. And that includes muscle wasting of those respiratory accessory muscles. This leads to further cardiopulmonary dysfunction with a potential for an increase in the incidence of multi-organ failure, length of stay, and in severe cases, death or disability in our patients. So we present here the use of a structured exercise program with resistance exercises in a patient that was a female in her 60s, and she had a history of idiopathic pulmonary fibrosis. She underwent a lung transplant, but then subsequently developed acute respiratory distress syndrome, or ARDS, and was placed on ECMO on a post-op day 13. So you'll notice in table 1, we outlined our rehabilitation protocol. Now, the rehabilitation protocol was standard of care in the morning with our physical and occupational therapists. And twice a day at minimum, she received a verticalization protocol with our nursing staff as well. And what's really unique about this exercise program is that in the afternoons, the exercise physiologist would help her do a series of exercises with resistance training. And there were about 11 exercises, and she performed the exercises or attempted to perform them at 3 sets with 10 reps apiece. And, the first half of those exercises tended to be focused on upper body, while the second half of those exercises focused on lower body. And the theory there is that if you load muscle, you'll preserve that muscle, which was really our intention. Some of our results are summarized in the figures. You'll notice in figure 1, it outlines her time spent in resistance training with time on the y-axis and days post-admission on the x-axis. Figure 1b outlines the same concept, but with time spent exercising total. Steps taken 1 minute is outlined in figure 2a, while her gait distance is outlined in figure 2b. And overall, what we learned is that there are potential benefits of high-intensity rehabilitation to enhance that physical function and that mobility in patients placed on VV-ECMO, and in her case, ones that are post-transplant. But what we really need is a more robust study. Obviously, this was an N of 1, so our next steps are really going to be looking into those pilot studies and an RCT, looking at the benefits of this kind of structured exercise program. Thank you so much.